The superficial group of large muscles of the gluteal region include four muscles: the Gluteus Maximus muscle, Gluteus Medius muscle, tensor fasciae lata, and deep to these three muscles is present the fourth muscle, that is the Gluteus Minimus muscle. These four are the large muscles of the gluteal region, and they are present superficial to the deep group of small muscles. Because they are large muscles, they has the power to abduct or extend the femur at the hip joint. First one is the Gluteus Maximus muscle. The Gluteus Maximus muscle overlies most of the gluteal muscles. This muscle is quadrangular in shape. Now came to the origin of this muscle. It has a broad origin. I have divided the origin of this muscle into four parts. Its origin from hip bone, sacrum bone, coccyx bone, and sacrotuberous ligament. On the hip bone, it originates from the rough area of the ilium behind the posterior gluteal line. This highlighted blue is the posterior gluteal line, and this is the rough area of the ilium behind the posterior gluteal line from where the Gluteus Maximus muscle originates on the hip bone. Number 2. The origin of the Gluteus Maximus muscle on the sacrum bone. Along the dorsal surface of the lower sacrum, the Gluteus Maximus muscle originates. This is isolated sacrum bone with the ventral surface. Now in the posterior view, this is the dorsal surface. This is the upper part of the sacrum bone, and this is the lower part of the sacrum bone. And the Gluteus Maximus muscle originates along the dorsal surface of the lower sacrum, as you can see. Number 3. Its origin from the coccyx bone. Along the lateral margin of the coccyx bone, the Gluteus Maximus muscle originates. This is isolated coccyx bone with the posterior view. This is the medial side of the coccyx bone, while this is the lateral side. And the Gluteus Maximus muscle originates along the lateral margin of the coccyx bone. Number 4. The origin of the Gluteus Maximus muscle from the Sacrotuberous ligament. This highlighted green is the Sacrotuberous ligament. The Sacrotuberous ligament has two surfaces, that is the internal surface and the external surface. And the Gluteus Maximus muscle originates from the external surface of the Sacrotuberous ligament. So this is the origin point of the Gluteus Maximus muscle from the Sacrotuberous ligament. After origination, the fibers of the Gluteus Maximus muscle goes downward and lateral, posterior to the hip joint. Now we came to the insertion. It has two insertion points. The upper fibers of the Gluteus Maximus muscle insert on the posterior part of the tensor fasciae lata. That is, these fibers insert on the tensor fasciae lata, and the tensor fasciae lata in turn insert on the iliotibial tract. So we can also say that Gluteus Maximus muscle indirectly insert on the iliotibial tract. The lower fibers of the Gluteus Maximus muscle insert on the Gluteal Tuberosity of the proximal femur. That is, these fibers insert on the Gluteal Tuberosity of the femur bone. This is isolated femur bone with the posterior view. This highlighted blue is the Gluteal Tuberosity, where the lower fibers of the Gluteus Maximus muscle is inserted. Next is the nerve innervation. The Gluteus Maximus muscle is innervated by inferior gluteal nerve. There are two main actions of the Gluteus Maximus muscle. Through its insertion on the iliotibial tract, it extends the femur at the hip joint. Number 2. Through its insertion on the Gluteal Tuberosity, it mainly rotates the femur at the hip joint. Because the Gluteus Maximus muscle has two insertion points, that's why it has two actions. The iliotibial tract stabilizes the knee and the hip joint. And since the gluteus maximus muscle is inserted indirectly on the iliotibial tract, so this muscle also contributes in the stabilization of the knee and the hip joint. That's all about the gluteus maximus muscle. Next, I will discuss the gluteus medius muscle. Thank you.